Hi everyone, I'm Rosalind Rice. I'm the Communications Coordinator for SIH. Today we're trying something new. This will be the first in a series of videos moving forward where we do this question and answer format where we respond to some of the questions submitted to us from across the system. Today I'm joined by Jennifer Harre. Jennifer is our Chief Nursing Officer for Southern Illinois Healthcare. And Jennifer, before we get underway with the questions, you had something special you wanted to share.
Thanks, Roz. Yes, today kicks off my favorite week of the year, and that is Nurses Week. This is not quite the way that we thought we'd be celebrating Nurses Week this year, when 6 months ago we were planning activities. A lot has changed in the last 6 months, in the last 6 weeks. But I wanted to take this opportunity before answering these questions to have a heartfelt thank you to all of you that are out working in the front line. There's a variety of nursing throughout this organization, and I would say I have seen nursing pull together and chip in from the clinics, pulling together call centers, working the drive-through clinics, answering phones, following up with patients, and then obviously those working in our ER and then in our COVID units. I'm just so honored to be your nursing leader, and thank you, and just want to celebrate you this week.
So as we begin, a lot of the questions really today involve PPE. Who decides the appropriate level of PPE within our system?
That's a great question. Man, a lot has changed, like I said, in this last 7 weeks, and where we started is definitely not where we're at today, and it may not be where we're at next week. So a little bit of background as recommendations. We work with our public health partners, the CDC, our Illinois Department of Public Health, and then the World Health Organization. And as we get those recommendations, we then pull together a team of probably about 12 individuals, frontline people in our organization, physicians, nursing, there was pharmacy, infection prevention, our HR, our employee, our OC health individuals, and we wanted to form this team so that we can give them the recommendations, and then they can vet through those recommendations and then come back to us to say this is what they believe is the right level of PPE.
So right now, how would you describe our supply of PPE?
So PPE is something that we talk every single day to our supply chain. We have a daily conference call to see what is our current burn rate, how many masks do we have, how many gowns do we have. Our supply chain folks out at the warehouse have worked endless hours to make sure that our staff have the right level of PPE. We often get the question, they think that we're hiding something because we can't tell the magical number of how much PPE we have. And it's really because it's difficult, because we could say we have 10,000 masks. Well, if we change our practice, such as universal masking, to where all patients and staff will be wearing masks, that's a lot different than if we weren't. So it's difficult to say exactly how many days of supply on hand, but what we can tell you is that we feel in a very good place because of the hard work of supply chain, and then also reaching out to other vendors we're used to not purchasing from and getting those supplies in the door.
So when it comes to PPE right now, what is one piece or aspect in particular that you are most concerned about?
Yeah, so right now, our most concern is on gowns. It's tough right now. Most healthcare organizations are struggling with gowns. We did receive our monthly allocation this past weekend. Again, the supply chain got those out to the hospitals immediately. We think that the yellow gowns should last about 2 weeks, and then they have the backup of the blue protection gowns to make sure to bridge that gap until we get our next allocation. So we will have gowns. It's just shifting between the yellow isolation gowns and those blue protective gowns.
But speaking of shifts in particular, why was the decision made to go from droplet to airborne precautions?
So again, we received notification that the CDC came out with updated guidelines. And in those guidelines, they stated that if your healthcare organization has enough supplies to treat with as airborne using the N95s or our cappers, then you should use that level of protection. So when we got that information, we pulled together the interdisciplinary team that we were talking about. We gave them the IDPH regulation or the guidelines, the CDC guidelines, and the World Health Organization guidelines, gave that to them, and then let them come back with the recommendations of what direction they felt that we should go.
So Jennifer, why did the team choose to go with an active decontamination approach versus what's known as a passive approach?
Sure, so when we first deployed the N95s, we gave them multiple N95 masks, and so after they would wear the mask, then they would place it in the bag and it would sit for a period of time so that that virus had a chance to die. There is new research, and the FDA has actually approved the use of active decontamination through the vapor hydrogen peroxide. So they've approved that, and so that team felt that that was a safer way that we could get a longer usage out of the mask.
Okay. So another question that has come in from the organization is with the deployment of more N95 masks. A number of these questions have involved the N95s, of course. Can you explain the difference between a seal test versus fit testing?
Sure. So SIH is a capper organization for airborne precautions. So when this pandemic happened and we were going to need to be deploying more airborne precautions, we didn't have enough capper supplies to meet the need. So we have N95s in the organization, but we did not have enough fit testing for all the N95s. And what fit testing is when they actually use a solution, they put the mask on, you go into a hood, you breathe, and whether or not you can taste the solution. Seal test is different. Seal test is another maneuver that you can do to see if you get a good fit on your mask with help of our occupational health partners. So when this interdisciplinary team got together, they decided, since we're going to deploy the N95 mask, the CDC, again, had said during this pandemic, then seal testing is adequate and you don't have to fit test. SIH wanted to take the stance that, okay, we'll deploy the N95s, but we wanted to give our employees the option, if they still felt safer being fit tested, if they had never worn an N95, we would give them that option. So what I would, again, reiterate, if you've had an N95 mask deployed, you would like to be fit tested and you have not been fit tested, please reach out to either your manager or somebody in occupational health, and they will make sure they get that set up.
And on the subject of masks, of course, we're wearing masks during this interview. Why is it important for everyone to wear masks right now, including our patients?
Yeah, really wearing the mask says that I care about you. It's not anything about me. You're not protecting me, I'm protecting you. And so that's really what universal masking is. If we can all wear a mask, then we know that we're protecting any droplets that I may or may not know if I have COVID, right? Because I may not have symptoms, but I may have COVID. So really, I'm protecting others when wearing a mask.
Thank you. Well, those are all the questions that we have for today. We look forward to doing this again here in the next week or two. If you have any questions you'd like to submit for our next question and answer video, make sure you just send an email to the System Incident Command email address. And thanks for joining us today.